Health alert: more adults under the age of 50 dying from colorectal cancers. But despite that, recommended age for colonoscopies is still 50 and 45 for African Americans. Here to discuss why, gastroenterologist with the Borland-Groover Clinic, Catherine Manalakis. So talk to me about why, even though we're seeing people having this cancer at 50 and dying from it, it's still staying at 50 for the recommended age.
Right, 50 for average risk people. 45 consideration can be given to African Americans for screening.
Because they're at higher risk.
That is correct. This is a reasonably new study, even though this information has developed over the past 10 years. We still don't necessarily have enough information to make a change in the screening recommendation right now.
But you did say if someone has symptoms that something's not going on right, they can get tested, and what would those symptoms be?
Correct. So I have to tell patients every day, rectal bleeding is never normal. And sure, for a young person or somebody without risk factors, you would typically consider that it would be hemorrhoidal or some other superficial cause. But it is never normal. It's certainly not worth the risk of waiting and having a progression of symptoms before we find a disease process.
And how do you know the difference between, okay, this is like slight bleeding from maybe a hemorrhoid, or, okay, is it a color of the blood or an amount, or how do you know?
No, I would say a colonoscopy would be the only way to really determine a difference.
Wow.
For younger people, other things to consider would be getting full quickly, or what we call early satiety. Unexpected weight changes or something else to look out for. If you have pain, particularly symptoms that wake you up at night from sleep, these are all things that need to be evaluated further.
Red flags,
absolutely.
Sure. And then you said if someone has a family history, they consider the age. Explain that aspect as well.
Absolutely. A family history of colon cancer or polyps, the recommendation is to begin screening at 10 years prior to the diagnosis. So if a parent had a history of colon cancer found at age 50, the child would begin screening at age 40.
A lot of people just don't want to do it, period. They do not want to go through the procedure. It sounds gross to them. It sounds painful. Whatever their reason, they're scared. How simple is it? Just break it down for people who haven't done it.
It's a very simple procedure. I tell my patients every day it'll be the best sleep you have ever had in your life. Typically, the bowel cleanout is the more, I guess, taxing part of the entire process. Unfortunately, that has improved dramatically over the past few years. The prep I prefer to use, you can still eat the day before. It's about 12 ounces total of prep. The rest of it is water. We split the dose in half, so that really does make a big change as far as volume of what the patient has to drink. And then a colonoscopy itself typically takes under 20 minutes. So really a very low-risk procedure and definitely high yield, especially if there are any symptoms or cause for concern.
That's not bad at all. And during that procedure, if something is found, if you see a polyp, you take care of it right then, right? It's not like, okay, well, now you have to come back. It's kind of a one and done.
No, that's correct. So we tell people that actually colon cancer is preventable by colonoscopy because we remove the precancerous changes, which are polyps. And actually very early colon cancers can be cured with colonoscopy as well.
All right, well, thanks so much for coming on. And
oh, absolutely. Thank you for the time.
If you're 50 and you haven't had one, you need to schedule one. And if you know somebody who could benefit from this information, maybe somebody who's a little difficult and doesn't want to get it done, be sure to share this interview with them to let them know how easy the procedure is. Of course, we're going to post that to news4jax.com later this morning. Just look on the morning show page.